Steve Adams here from Tiger Medical Institute. And in this video, I want to talk about how to reduce inflammation in my body. You know, in genetics, only about 20%, even less than that, really drives what our longevity is. The rest of what we do, the lifestyle choices that we make, drive our longevity. They drive how we experience life from a health perspective. That's kind of setting the table for what I'm going to talk about today. Well, you know, we make bad decisions in general. You know, our Western diet and sedentary lifestyle, are always on, always available, high stress lifestyle has led to the point where, according to the CDC, 60% of Americans have a chronic disease. And of that 60%, 40% have more than two chronic diseases, such as diabetes, high blood pressure, cardiovascular disease. Well, our sick care model of medicine is failing us. Now, it doesn't mean that healthcare providers are bad people. They're amazing people. It's the system, okay? If it were working, then chronic disease would not be a runaway train that it is, okay? Medical researchers are predicting that 90% of the adult population will suffer from a chronic disease by 2050 if something doesn't change. So, we're going to talk about three things in this article, in this video. One, root causes of chronic disease, inflammation as a primary catalyst of chronic disease, and then how we at Tiger Medical can help you reduce your inflammation levels, and because of that, slow the aging process down and be able to live better, okay? So, what are the root causes of disease? Well, there's four major causes. Number one is tobacco use or the exposure to secondhand smoke. Okay. Number two is poor nutrition. And if you live in the West, you eat poorly by default unless you make a very specific effort to improve your diet and eat a lot of fruits and vegetables and eliminate the saturated fats, the high sodium, and all of the meat, okay? Number three is physical inactivity, meaning sedentary lifestyle. And four is excessive alcohol use. All right, so now what I want to do is now transition to the role of inflammation in catalyzing chronic disease. And what you're going to note is that there's a lot of similarity between the root causes of disease and what causes inflammation. Okay, number one is poor nutrition, okay, with a lot of ultra-processed, sugary foods and drinks. Those are highly inflammatory, okay? Something as innocent as popcorn at the movie theater. Our doctor at Tiger Medical says the most inflammatory food you can eat almost, all right? Secondly, sedentary lifestyle with a lack of exercise or daily movement. Sounding familiar? Okay. Number three, alcohol, nicotine, and drug abuse. So that's 3 for 3 so far. Now what we're going to do is we're going to add in chronic stress and anxiety. And number 5 is poor sleep quality, okay? Our Western lifestyle promotes a lot of stress and poor sleep. So these are the root causes of inflammation, okay? And according to the National Institute of Health, the NIH, inflammation plays a key role in many diseases, some of which are becoming common and severe, okay? So, here's the thing. If you can change your lifestyle factors that cause inflammation, that cause chronic disease, you're going to reduce the risk of getting chronic disease, and therefore you're going to stack the odds in your favor of extending your health span, meaning the number of years that you're healthy, as well as your longevity, okay? And this is where Tiger Medical comes in, because we provide a clear roadmap how to do this, how to reduce inflammation and therefore improve your health. Okay, well, how do we do it? Well, our process never changes. All right, if you work with a Tiger Medical staff, you're going to establish an extensive medical data baseline that tells us the truth of where you are today. Okay, that's going to involve an intake interview for 90 minutes. It's going to involve an online survey where you tell us all about your past and your current lifestyle. And it's going to be about testing that is at a very high level that is going to tell us a lot about your current state of health where you are in terms of potentially contracting disease, as well as the level of inflammation in your body, and you start working with Tiger Medical, okay? And from this mosaic of data, the clinicians at Tiger connect the dots from all the testing, from the imaging, from the intake, and they create a personalized plan for you to reduce your inflammation, to slow the aging process, to optimize your health, all right? Tiger clinicians understand the drivers of inflammation and will go to work at treating those underlying mechanisms that are causing your inflammation, okay? And while you're doing all this testing, you're going to start working with a health coach who is highly credentialed and trained. They're going to help you make lifestyle changes that are going to address those causes of chronic disease, those causes of inflammation that I talked about earlier, okay? And so you're going to enter into a process. And so at the end of the day, you're going to work that process with a coach, you're going to work on the treatment plan, and as you do, you're going to improve your inflammation. My inflammation was reduced by 500%. That is very common for our clients at Tiger Medical. All right, so what are your best steps? All right, next steps. First, if you're ready based on this video to have a conversation, I would love to talk to you. Just go to our website, click on health assessment, and you'll get to talk to me or one of our pros at Tiger, okay? And on there, we're gonna learn about you first, and then we'll present what we do, and then you can make a decision. If you're not quite ready for that, go to our learning center and find over the left side the types of things that you're concerned about. Click on there, and you're gonna find multiple videos and articles about that issue. And that'll get you educated and more comfortable, okay, before you talk to someone. So make yourself patient number one, embrace self-care, be proactive, take action today. I hope this was helpful.